Welcome viewers, my name is Dr. Wachira Murage from the Savannah Hospital. Today I want us to discuss something very important, something dear to our hearts, something that each family should know. This is family planning methods. And what are family planning methods? They're just medications, or they're just methods that are used, and they're different types, and they're used to plan a family. Just like the word says, family planning. You want to get a baby at your own time, according to your own plans, and when you feel like getting a child. And in between, then you can use something to prevent you from getting pregnant. Those are the family planning methods. And they're different types. Broadly, they are divided into hormonal and non-hormonal. Hormonal are things like pills, and we have some of them here, family planning pills. They are combined pills. There are so many types. These ones are called family planning, and there are quite many, and they are combined family planning pills. They're just tablets, as you can see, and they are normally arranged like that. So you just take according to the arrows. These ones are just iron. You must not take. They're just there to assure you of continuity, so that you get used to that rhythm of continuing to take something every day. So these ones are combined, meaning that they have estrogens and progesterone. Then there are others that are single. They are not combined. They either have progesterone or estrogen alone, and they're used at different times. Then, of course, there is injection, which is an injection for every month, for every 3 months. Of course, there are other types for every month, Norgainon. Then the others for 2 months, and then, of course, there's the commonest, which is Depo-Provera, which is normally used every 3 months. From there, then you have the Evra Patch. It's just like a sticker that is normally put on the side of the chest wall. And that Evra Patch is a single agent. It has progesterone alone, and it is hormonal. Then from there, then you have the implant, and with me here, this is called Jadel. As you can see, it has 2 sticks. Then you have another one, it's called Implant. It's normally packed like this. It's only 1 rod like this one. It's normally shorter, but a bit plump. This is for 5 years, and this is for 3 years. Then, of course, after that, there is a type of a coil. I don't have it here. That coil is just plastic, but within the plastic, they have embedded it with hormone. And once it's put in the uterus, because it's put right into the uterus, then it works on the wall of the uterus. That is called Mirena. That is the name given, but instead of vanogestrel, it's a hormonal coil. Away from the hormonal ones, then you have the non-hormonal ones, and the commonest are these 2. Yeah, so you have copper. This one is called copper T. It's normally packed. This is the way it looks like, the copper T. As you can see, it's a T. Okay. And then you have another one called multi-load, and you can see the difference in the amount of copper. The multi-load has only copper on that bar. On the side is just plastic. So this is for 5 years, this is for 10 years. And they are quite effective. Then, of course, away from the coil, then you have the barriers, and those are the condoms. And the male and female condoms. Then you have what you call NFP, the natural family planning method. Those are the counting of the days, and of course withdrawal, and using other sort of barriers like tablets, vaginal rings, and diaphragms. Those ones are normally put at the cervix during coitus. Then, of course, you have the permanent method, and the permanent method are 2. You have the tubal ligation. And then, of course, you can have vasectomy for the man. Those are permanent methods. A family decides we have had enough, and therefore now they can have their permanent methods. Of course, reversal is normally very difficult, so we advise that if a family has to embark on the permanent method, they should have agreed and said, yes, this is permanent, you don't need more children, you're happy. They can even consider using the other family planning methods, like the long-lasting ones, like these two are long-lasting, the coils are also long-lasting. Then if they decide, then enough is enough, then they can use the permanent methods. Again, the permanent methods are normally used in the situations where there are other comorbidities, like heart diseases, someone who has done several surgeries, like cesarean sections, then they can use the permanent methods. And of course, as a choice, but we do let the clients know that we have long-term methods. The IUCD, the copper coils, and the implant are long-lasting methods. So you just need to look at the side effects of each, and then you're able to counsel and to allow the clients to have an informed choice. The side effects of hormones are like bleeding, irregular bleeding. You can have excess bleeding, you can have weight gain, you can have blood pressure, you can have chest pain, nausea, you can have sometimes even headaches. Those are the common side effects for the hormones. When you look at the non-hormonal, that's the coil, they have very, very few side effects. When you're looking at the copper-based, these ones will have maybe side effects like spotting, maybe side effects like, irregular bleeding, but most of the time, they have very, very minimal side effect. Now, they are not as effective as the hormones. The hormones are about 99.9%, but the copper-based are about 97%. So we do have failure on each side, but probably more on the copper and the natural family planning. When you're talking about permanent, you're saying it's permanent. And the side effects for permanent normally is sometimes people can get regrets. And that's why we normally would want decisions to be made. We want to discuss about other methods before we go to permanent, because once you have done the permanent, it means then reversal is a problem. And many couples, we always kind of say, oh, I wish I knew, I would not have done this or that, and therefore it poses quite a challenge. But permanent methods, these days we don't get it so much because of the long-term methods that are in the market. Very, very, doing very well in terms of efficacy to prevent pregnancy. They are very efficacious. So, but still, we do get a few cases that request for permanent methods. Of course, there are so many things discussed about the various types of family planning methods. Some people say, oh, they cause infertility. They do not cause infertility. Of course, the permanent methods cause sterility. But these methods do not cause infertility. They are very good. And people always say, oh, I'll be put the coil, it might disappear into the body, into the intestines. Yeah, I'm happy to report that they do not that. If the coil goes into the uterine body or outside into the intestines, then it means that maybe the healthcare worker who was doing it perforated the uterus, and then they pushed the coil right into the different parts of the body, and therefore that's different. But when the coil is put, it does not cause any problem. Of course, people say, oh, it causes some coldness, it causes menopause. These methods do not do that. When you come over for a consultation about family planning methods, what we do as doctors, and this is what should always happen, is that you want to do a quick history about yourself, because if you give us history of some disease like diabetes, hypertension, coagulation disorders, maybe unexplained headaches, unexplained chest pain, we may discourage you from using the hormone ones. Okay? We want to encourage you to use maybe the non-hormonal. If, of course, you come and say, oh, I've had pelvic infections, then you want to discourage you from using the IUCD. So it's from person to person. And we normally would want to take your history. Even an elderly person, maybe with clotting problem, we want to avoid the hormonal ones. So we take case by case. The other thing that you look at is how long do you want to use the family planning, because they are short duration family planning methods and long-term family planning methods. Of course, things like the coil, things like the implants are long-term. So if you want to use something, you want to space for 3 years, 5 years, then you go for the long term. If it's a short time, then you have the pill. And then of course you have the injectable, which is normally about 90 days, 1 month, and 2 months. So it depends on how long do you want to use the family planning methods. Of course, the age, we do discuss. Of course, there's a right for every woman, as long as they're above 18, to use a family planning method. So we do discuss, because there are ladies who have not had children, but they still want to insist that they want family planning methods. Of course, we counsel them against infections, because of course we know that they are prone to multiple sexual partners. So we want to discuss with them maybe condoms or things like that, abstinence and things like that as form of family planning methods. But still you find that they still insist that they want to use family planning methods. Of course, now such young girls, we want to really do them counseling before we embark on any family planning methods, for them to be able to understand what they are going into. Because in as much as the family planning methods may not harm their body, it exposes them to infections, including HIV and other STIs. And of course, remember, cancer of the cervix is associated with HPV as an infection. So we want to discuss those issues when we are discussing with a young person who probably is not married. Normally, the family planning methods, once you put them in terms of follow-up, we just want to see the clients as they come for pap smears. Once we insert the IUD, we want to do an ultrasound immediately to ensure that it is in position, and therefore then after that, we let them go. Of course, we discuss with them about the failure rates, especially the coil, and the pills, especially if there is poor compliance. We want to tell them that they can fail, so that they are aware. Of course, the hormones have a failure rate as well, although it's very, very low when they are used properly. But we like them to understand that there is all that when it comes to the success of the family planning methods. Now, pap smear is mandatory. We like telling people that yes, we know you can have some irregular bleeding with the injections, with the pills, sometimes even with the implant, and therefore we insist on pap smears, because we have found that some clients get some abnormal bleeding, which can be a sign of cancer of the cervix. And the users, you think maybe I'm having abnormal bleeding because of the hormonal contraceptive. So we insist again on the routine pap smear, which is every 2 years or earlier, depending on if there is any symptomatology. Savannah Hospital, with its branch in town, we are equipped with all types of family planning methods. This is a clinic that has gynecologists from Monday to Saturday and on call 24/7. We are accessible, and our family planning methods are available, all of them, right from the hormones right into non-hormonal, and even you have theaters in case one needs to undergo the permanent methods. It's very affordable for everybody. There are some, we take all the insurances and other corporates, and we know that there are some insurances that do cover for that. And we are on call. Our numbers are on our pages, and we always give our numbers easily, and someone can reach us on my number, which will be on the screen, so that you can arrange for your family planning session, a device. You also do messages and telemedicine for those ones that are far. We normally talk to them and advise them on family planning methods. So welcome. Do not feel left out. In case you have questions and queries on family planning methods, do reach out to us. For any queries that probably we have not covered during this short session, please text us on Facebook. We will be able to answer, and other digital platforms that we are on, we'll be able to answer all your questions. Thank you very much.